After preparation with a topical anesthetic, the flexible bronchoscope is inserted through the right nares. The scope is advanced through the nasopharynx and positioned within the larynx, just above the vocal cords. Additional anesthetic is instilled through the working channel of the bronchoscope onto the vocal cords. The bronchoscope is then advanced into the trachea and down into the right lower lobe where the lesion can be seen. Note the two raised pinkish-white papular lesions in the right lower lobe bronchus, which were pathologically proven to be carcinoma in situ. Once the bronchoscope is properly positioned, the brachytherapy catheter can be advanced through the working channel. The catheter is then placed adjacent to the lesion and the bronchoscope is carefully withdrawn, leaving the catheter in position. The bronchoscope is then reinserted through the opposite nares and repositioned to visualize the lesion. Using the external numbered markings as a guide, the catheter can be adjusted for final positioning. The bronchoscope is once again removed with care so as not to dislodge the catheter, and the catheter is securely taped to the face mask. The patient is then transported to the Department of Radiation Oncology. The catheter is then attached to the high-dose rate brachytherapy device. Under computer guidance, the radioactive source is advanced through the catheter and positioned adjacent to the lesion. A very intense localized dose of radiation is then delivered to the endobronchial lesion with minimal damage to the surrounding structures. The computer then withdraws the radioactive source and stores it safely within the brachytherapy machine. The brachytherapy catheter is then easily removed and the patient is allowed to go home.